So I do get asked a lot, you know, what happens if I don't treat the tongue tie? And I try and tell parents all the time that I don't have a crystal ball. I wish I did. But what I see in the clinic so much, I see so many kids, and I ask all the questions: how's sleep? How's feeding? How's speech? If there's any issues with any of those, I pull out the paperwork and we go through the history. And what I find is the overwhelming majority of the kids that have issues in either speech, feeding, or sleep struggled in the beginning with nursing or bottle feeding, and they just got by. They either were breastfeeding and switched to a bottle, or they used a nipple shield. Whatever they did, they just kind of made it through, but there are lasting effects with either speech, feeding, or sleep. And not only that, all that has to do with growth and development, because if that tongue can't rest in the palate like it should for proper nursing, then that growth and development is impeded. So what happens is, as that tongue is low in the floor of the mouth, it guides the growth down and back. It's taking that chin, pushing it in the airway. The tongue's attached to the chin. That pushes the tongue in the airway space, causing kids to be restless in their sleep and poor growth patterns. When that tongue is resting in the roof of the mouth, the floor of the nose and the roof of the mouth, they're the same bone. So as that tongue is down, that arch is able to squeeze in. Every time that baby is sucking, and that tongue isn't counteracting that pressure, that arch is going, and it's shrinking the floor of the nose. It favors mouth breathing, making nasal breathing harder. It crowds the arch. Your teeth come in crowded. And then what happens when you have a small arch? Where does your tongue go? It can't fit in the house it has. So I tell parents, you're growing airways right now. You want wide and forward growth, and that tongue is what's going to get you there.